I'm Dr. Erin Gilbert, and I'm the host of Modern Aesthetics Journal Club. Today I have with me Dr. Doris Day, who's a clinical associate professor at NYU, and we've got a great segment planned. So Doris, tell me, we're going to be talking today about the latest in facial neuromodulation.
This is such an exciting topic because we first had Botox, FDA approved, for modifying and improving the appearance of lines and wrinkles for the lines between the eyes. And that really revolutionized the aesthetics because it allowed us to look at patients a little bit differently and open the dialogue towards rejuvenation with a non-surgical approach. Since then, we've had lots of other devices and treatments between soft tissue fillers, skin tightening devices, resurfacing devices, and advancements in our techniques. So there's been a lot that we can do, and it's really coming down to the idea that we can ultimately, maybe not that far in the future, forget the facelift. And there's going to be so much we can do for our patients to help them look like the best version of themselves, to age successfully without surgery.
That is really exciting, and I know that for all of us, we are sort of looking for what's new, what's cutting edge. And so why don't we dive in?
Okay.
Tell me a little bit about what's going on.
Well, for about 25% of women who are considering wrinkle reduction treatments, they really just are not interested in the neuromodulators. They consider them poisons, and for whatever reason, maybe they're planning pregnancy or they may be pregnant, and they just don't want a neuromodulator. So Ayurveda is a company that has come up with, over a long period of time, it's been a very slow, long process, really over 10 years, of developing a technology that uses focused cold therapy to target the temporal branch of the facial nerve and to basically just temporarily knock it out. That gives you a Botox-like effect of just smoothening the frontalis completely and gives that effect for about 90 days, about 3 months.
Wow, so what I've heard, and this is sort of what's interesting to me, is that there's great things, which is that you're doing a technique that is completely non-toxin driven.
Right.
But that sometimes you have a little bit of a limitation because you're getting in there and you only have one focal point, which has been sort of spoken of as using a tree trunk to approach a larger area, meaning you don't quite have the ability to refine in the same way we do with a toxin.
That has pluses and minuses.
Okay.
So I wouldn't even say tree trunk, I would say a tree branch, because
Okay.
we're not really hitting the whole trunk. We're just hitting really that one particular branch that feeds the frontalis. Now, I happen to agree with you in the sense that it's nice to be able to have finesse, to just hit the parts of the muscle that you want. And here we're really hitting the branch of the nerve that affects the entire muscle. But there are times when you hit parts of the muscle, and because the frontalis is such a big muscle, that if you hit it effectively but you miss a point, you can have some hyperdynamic movement in the areas that you didn't get. And that can make someone either look like they have a pulled brow or to look a little uneven.
Right.
And left and right sides are also different. So if someone treats the entire frontalis the same across the whole forehead, then one side will look different than the other. When you're hitting the branch of the nerve, if one side is a little bit different, you're hitting the whole muscle equally on both sides because it's the nerve that has the weakness on one side over the other. So your results will be consistent and will be the same on the left and right side. So for somebody who really wants that smooth forehead, who doesn't want to have to come back to have it checked, or someone who gets those lines at the top that you don't like, things like that, that will be knocked out. You'll get them instantly in one visit for a reliable amount of time.
That's great. So it is one visit, because I've heard varying tales, like you have to do multiple treatments, you have to come back and do 3. I've heard that in Europe, in a couple of contexts in Europe. So in your experience, that isn't the case.
In the clinical trials, and I participated early on with the trials, you could tell immediately when you knocked out the nerve.
Wow.
Now, the times when someone may have to come back is that you do a nerve block ahead of time, and sometimes that can knock the nerve out as well temporarily just from the anesthetic. And so you can't tell if it's the treatment that had the effect or if it's just that nerve block. So otherwise, if the nerve block didn't and you see the effect immediately, it's done. If the anesthetic wears off and you realize that it was a nerve block that did it, they may have to come back for a second treatment. But when you look at these patients, 90% of people treated at 30 days continue to have a 1-point improvement, and 70% had a 2-point improvement.
That's
So
great.
it's significant, yeah.
Yeah, so that's a big deal.
Now,
Okay,
I don't think
great.
it's going to replace Botox or Xeomin or Dysport. Those are tried and true. We're comfortable with them, and frankly, I love when a patient comes in and they say, I don't want Botox. It's a poison, and they go through, and I don't want to be frozen, and all these different things that they say. Because once I have the discussion with them and I explain that this is an FDA-approved drug, that it's been available for over 20 years, that it has so many indications, that we know down to the molecule how it works, its precise placement. They, at the end of the visit, then they say, can you do it now? And I say, no. You have to come back and ask. I make them want it, really. But it is one of those things where there are specific times, like in pregnancy, where the cold focus therapy doesn't put anything in the body. And so for someone who, for whatever reason, doesn't want anything injected, this is a nice alternative. So I think it'll be a niche kind of a process. And it's exciting to have alternatives, but it's not going to have a big impact on our Botox and neuromodulator treatments.
Okay, good. We're safe.
Yes,
we're safe in doing that.
And our patients are safe.
Yes, they are. That's great.